I am Dr. Vijaya Bhaskar, Masters in Orthopedics, Professor in a medical college, and I am a Chairman for Ethics Committee, Clinical Research and Trials. The spondylitis is the most common cause where the joint areas or joints of the facets, these are the spondylitis means a spine, the joints are developed arthritis is called spondylitis. So you take it for granted every bone in the spine or the back will supported with the two facet joints. You can see it here. These two facet joints obviously due to injuries or due to degenerative changes or due to osteoporosis or due to nutritional deficiencies or due to any other cause like vitamin D, calcium deficiency or wear and tear is more in the profession where injuries are leads to damage to the joints, both the joints. When both the joints are pedicle joints, we call it, when both the joints get eroded or the necrosis is happened, then there is a possibility of inflammation in the joints which leads to spondylitis. So spondylitis is a general word for spine like neck spine, back spine, low back spine and the pelvic spine. So these are the various parts where every bone will join with another vertebral bone with two facets. So likewise, you take it from the top to the down, you will have two joints in each vertebra where a lot of other joints are associated with the diseases leads to degenerative arthritis or pain, that is called spondylitis. So you should know what is the cause for spondylitis, whether due to age or whether due to comorbid disease or whether due to injuries or whether due to osteoporosis, we must rule out. Once you rule out with the major causes for the spondylitis, then accordingly we should treat. As usually every spondylitis we treat with the painkillers and then we give some supports to the spine. Obviously you feel that once the pain is controlled with the painkillers, patient feels happy and he neglects. So obviously we must rule out whether person is having nutritional deficiency like osteoporosis, vitamin D, calcium and minerals, or whether the person is suffering with an injury to the facet joints, or whether he is suffering with the disc prolapse, or whether he is suffering with bone degeneration and then possibility of any tumors or any other causes. Once you rule out that the cause, the problem in the arthritis or a problem in the spondylitis can be treated. Usually most of the spondylitis in early stages, we after taking the MRI, CT scan and X-rays rule out and then we treat according to the issues. So usually first when there is young people, we always tell them to take the painkillers, disease modifying painkillers, so that the pain will be relieved. After that we ask them to do certain physiotherapy. So when there is a severe pain, we ask them to use the collar or the brace to support the joints to avoid excessive movement so that the pain gets relieved. Then after that, if these certain pains which are not relievable or which are because of certain chronic diseases like rheumatoid arthritis or any other arthritis, there will be severe pain in the joints where we can give localized injections to relieve the pains. So apart from all these things, if there is some other cause where there is a possibility of severe arthritis or spondylitis, certain times we have to immobilize the joints with pedicle screws with the rods so that the pain in that joint can be relievable, so that person will not suffer more. So this is the way in spondylitis we treat with the basic medication, splinting, physiotherapy, if necessary, very rarely surgery.